Chapter Bobby Aylward.
Good. I want to ask the Minister for Health the steps he and the Health Service Executive have taken regarding the issue of children affected by fetal anticonvulsant syndrome in circumstances in which children were exposed to sodium valproate medicines in the womb. His plans to conduct a review of the families and children affected by this issue. His further plans to set up a compensation scheme for the families affected in view of the compensation scheme set up in France, and if he will make a statement on this matter.
Thank you, Deputy Minister.
I thank Deputy Aylward for raising this important important question. I had an excellent meeting with the Facts Forum only a matter of weeks ago. I'm going to estimate about 2 to 3 weeks ago. I had an excellent meeting with them here in Leinster House. A number of deputies had requested that I would meet them. I met with them with representatives of my department and the HSE. So sodium valproate, as the deputy says, is a medicine licensed for use in Ireland to treat epilepsy and bipolar disorder, and it is marketed in Ireland under the brand name Epilum. It is now well established that children exposed to valproate in the womb have an increased risk of congenital malformations and developmental disorders, often described as fetal anticonvulsant syndrome, which is facts. In 2014, the European Medicines Agency, or the EMA, conducted a review of valproate and issued advice placing additional restrictions on the use of valproate for women and girls. In March 2017, the EMA's Risk Assessment Committee initiated a new review of the use of valproate in the treatment of women and girls who are pregnant or in need of childbearing age. This review has now been concluded, and the committee's new recommendations on sodium valproate were published by the EMA in February. Some of the key measures recommended by the EMA include that valproate must not be used in pregnancy for the treatment of migraine or bipolar disorder, that valproate may not be used in pregnancy for the treatment of epilepsy unless there is no other treatment option available. Some women may have to continue treatment with appropriate specialist care in pregnancy. Valproate must not be used in female patients from the time they become able to have children unless the conditions of a new pregnancy prevention programme are met. The EMA has also recommended that the outer packaging of all valproate medicines must include a visual warning about the risks of the pregnancy. A patient reminder card will also be attached to the outer package for pharmacists to discuss with the patient each time the medicine is dispensed. The HSE is working with my department and other stakeholders such as the HPRA and the Pharmaceutical Society of Ireland to communicate and implement the recommendations of the EMA's review. I understand that the HPRA yesterday, in fact, issued a drug safety newsletter on sodium valproate to all relevant healthcare professionals, together with updated safety information from the drugs manufacturer. Both of these communications reflect the new EMA recommendations and restrictions.
Thank you.
I recently met with the Facts Forum, and perhaps I'll come back to you on the outcome of that meeting.
And the rest of your reply will be on the record. Deputy, 1 minute.
In a written parliamentary question response to my colleague, Deputy Lisa Chambers, in November last year, you acknowledged that children exposed to valproate in the womb had an increased risk of congenital malformations and neurodevelopment disorders, including autism. You also stated that a warning label for the outer packaging of Epilum products was introduced in Ireland in early 2017, and that products carrying the new external warning label were being supplied to retail pharmacies. Now, I have different information that I had 2 mothers in from Kilkenny who got this package in the chemist locally in November, and there were no warning signs on it, so it's not being implemented, and that's what I want to come to. Can I ask you, Minister, if the Department and the HSE are enforcing this directive well enough? Are you monitoring the implementation of this warning label on these products, which you previously acknowledged pose an increased risk to pregnant women? I ask because, as I said, I met these 2 women, and both of them were still receiving the drug Epilum in a plastic bag with no warning label. They were understandable and genuinely upset, not only because of their own personal situation, but because they are all too familiar with the increased risk and danger being posed to other women by the lack of such warning labels. Minister, are the Department and the HSE doing enough in raising awareness and warning vulnerable women of the risks proposed by valproate-containing medicines?
Thank you.
Thank Deputy Aylward. As I said, I had an excellent meeting with the Facts Forum. I was delighted to hear directly from parents who have been impacted by this. Parents who I believe have been let down. And this, as you say, is not just an Irish issue. That's why the European Medicines Agency have been looking at it. But there are 3 issues for me, and the 3 issues I discussed with the Facts Forum. The first is, what do we do going forward to address the issues you talk about in terms of the labelling and the safety and people knowing the appropriateness of prescribing or not prescribing this? And as I said, as recently as yesterday, the medicines regulator issued new guidance on that to all stakeholders. So I am confident and satisfied that the HPRA are implementing the recommendations of the European Medicines Agency. So in my view, that's the body of work that we need to keep a close eye on, but that is progressing progressing well. How do we make sure from this point on the correct information, correct labelling, correct wording and appropriate prescribing is dealt with? Second issue, though, is what do we do for the children who have been born with malformations and disabilities as a result of this situation? And I was concerned when I met the Facts Forum that these are children dealing with lots of different doctors, lots of different conditions, no two children necessarily with the same set of conditions. And I'm a little concerned that they've been running around from Billy to Jack. I want them to have one single point of contact within the HSE that can give them all of the information. And I've written to the Director General of the HSE on the 17th of April, just this week, instructing him that all of the clinical leads in the HSE and the Children's Hospital Group need to meet with the Facts Forum to discuss how do we deal with these children's needs, just like we've done in other areas. And the third issue I just need to look at is how do we look at the past? How do we check if Ireland in the past did everything that it could have done to make sure parents were aware and to follow appropriate guidance? My colleagues in the UK and France have initiated some reviews in this regard, and I've promised to consider that and revert to the Facts Forum within the next month.
Yes, Minister, directives and implementation is the important thing. You know, who's going to monitor this? And this is the problem that I'm saying. Why there are young children in this country which are suffering due to exposure to valproate containing medicine. Children as young as 6 which have had to endure hospital appointments and more surgeries than most adults during their entire life, as you admit yourself. Will you commit to look at a specific support and service system for affected children and their parents? When asked about this previously, you pointed to the National Disability Strategy. That's who you pointed last time. This is a very complex and difficult issue which requires a targeted specific support service system. I do not believe it is fair or proper to simply cite a commitment in the programme from government and consider this problem solved. These children and their families need recognition and support from the state. In terms of compensation for these families, you stated previously, as I said in the written PQ, that you were aware of a state-funded compensation scheme in France, which was considered claims for individual effect. Are they going to be a compensation system set up? And when, and what time scale are we looking at that?
Thank you very much. Final comment.
Of today or yesterday, but unlike in the past, I've taken a very personal interest in this. Unlike previously, perhaps people in the Department of Health have looked at this issue. I've met with the Facts Forum. I've heard what they've had to say. I've made three very clear commitments to them. One, in relation to how we make sure this doesn't happen going forward, appropriate labelling and implementing the EMA recommendations. Two, how do we deal with the children now, who you rightly say are living with very difficult and complex conditions, and their parents aren't being adequately supported. And that's the purpose of the Children's Hospital Group and the clinical leads sitting down with the Facts Forum and having an understanding of what these kids need and how they're going to actually streamline supports for them. And thirdly, which is the kernel of your question, what are we going to do about what happened in the past in relation to firstly investigating what happened and secondly seeing if the state did everything appropriate in that regard. You're right, my counterparts in the UK and France have recently announced processes to do this, and I've informed the Facts Forum I'm considering that in consultation with officials, and I will come back to them within a month with my proposed course of action.
Thank you, Minister. Thank you, Deputy.